Welcome everybody to the Thursday, April 30th, 2020 Winnebago COVID-19 weekly live stream. Today, Chairman Brown is running behind schedule, so we're going to open up and turn the floor on over to the Winnebago Health Department. And at this time, we appreciate everybody tuning in. Those that have questions, don't forget to email covid@winnebagotribe.com. And today we have a special guest, a Winnebago youth, Tyler Lemire, will be discussing on a roundtable discussion with us here today. So we appreciate her time. But at this time, we're going to turn the floor over to Mona Zavante, the Winnebago Public Health Administrator. Mona.
Thank you, Garen. Good afternoon to the Winnebago community. These past weeks, we have begun to realize how life-changing that COVID-19 truly is, and it has made its way into our lives of our loved ones and those with great connections to our community. There is not a day that goes by that we don't know someone that this virus has touched and altered. We continue to be vigilant here in Winnebago, as every member of our community is precious, and we are doing all that we can to educate, empower our people to make the necessary changes in their lives to make the educated choices. I know that we all have moments of panic and fear. These are all understandable, and we will all face them and have to deal with them the best way that we can. We are all in this together. We are all working towards a common goal. Angie will go over it in further detail, but I just wanted to kind of touch on what the contact investigations look like. We start our interview with the positive case. The close contacts are those people that have been in contact with the positive case for more than 5 minutes and less than 6 feet. Those close contacts are now monitored for any symptoms. If they become symptomatic, and only when they become symptomatic, will we have them tested. These close contacts will be placed in a heightened isolation for 14 days from the last contact with the positive patient, unless they develop symptoms. Then that may change. Once they become symptomatic, then we start to do the close contacts of them, and then we follow the same process. I understand that we all may want to be tested, but at this time, it's not available. It also means that you may not be, if we test you today, and then you go out and about, you may not be positive that day, but you could turn into being positive 2 days later. So just because this is not your get out of jail free card because you test negative, we still need to practice our social distancing and isolation. You may come into contact somewhere else and now be infected. I just don't want anyone to let their guard down. I know that we are a tight woven community and we are on the heightened alert. I know that we want to make sure that all of our loved ones are safe, especially if they have come into contact with someone that may be in contact with someone else. We just do not test asymptomatic community members. The best thing that we can all do is continue with our social distancing, isolation, disinfecting surfaces, and wear our masks that have been generously purchased by the Winnebago tribe for the Winnebago community. Now, the testing criteria changes periodically to allow us to open the testing to others. I know that those are just words, but we are testing everyone that comes in with the appropriate symptoms that could be linked to anything related to COVID-19. Life as we know it may be forever altered until a vaccine for this virus is found, but we will continue to persevere. On a brighter note, I would like to thank the medical services programs that delivered 295 masks on Tuesday, 260 masks on Wednesday to the Winnebago community households. I want to especially thank each member of our staff that continues to put themselves at risk for interacting with people by going door to door with the appropriate personal protective equipment. The public health nurses and the diabetes nurses that have been answering the hotline that has had over 100 calls. If you call outside of a normal business time, 7 to 9, we'll get back to you as soon as we can. People do need to sleep. We have received some additional funding for our senior citizens program, and we have started providing freezer meals by Mary Kelsey and Lloyd Hamilton, and they're extraordinary helpers. They are also helping the senior center deliver meals. Everyone is coming together to help one another to fight for our very existence. Thank you to all of those that work behind the scenes. All of us are at risk for COVID-19 infections, so stay home, stay healthy, and stay connected. Now I will turn it over to Angie Keller, our Public Health Nursing Director, that will start this week's presentation. Thank you.
Hey, Angie, this is Garen. Sorry, you gotta unmute yourself. There you go. Thank you.
Sorry, I got it. I want to thank everybody for being here and taking part in the community update. We're doing everything we can to keep everyone safe and healthy. And we just wanted to go over some of the things to give some additional guidance to how anybody in the community can do that. So the current statistics for the national and state and Winnebago community are the US total cases of COVID-19 is 1,005,147. The total deaths that have been noted in the US is 57,505. The Native American cases in the United States is 2,341. Nebraska currently has 3,784 cases. There's been 68 deaths. The total negative cases that have been, or the negative tests that have resulted are 21,537. And then the total cases that have been tested throughout Nebraska is 25,498. So within Winnebago community, there has been one positive case. There has been 8 negative cases or 8 negative tests completed. Currently, there are 8 pending tests that are pending results, and 6 of those are from outside facilities. And then we have tested a total of 17 cases in the Winnebago community. And then the outside facilities are due to if there are different areas or different facilities that was more accessible to an individual to get tested, then we would send an order to that facility or that area in order for the testing to be completed to make it more convenient for the patient. And then for non-Winnebago cases, there has been 3 positives. They have they've resulted 16 negatives. There is still 13 pending, and 7 of those are in outside facilities. And then there has been a total of 32 cases tested for non-Winnebago community members. And again, those outside facilities are due to the convenience. It's an increased convenience, or it was more convenient for the patient to be tested somewhere else other than here at Winnebago. And then the risk of exposures, I wanted to go over those with you as well. The highest risk of exposure is when there's a recognized risk of transmission. So when a positive case or a positive individual is living in the same household or has close family members that have had close contacts, which is 6 feet, less than 6 feet for greater than 10 minutes of a confirmed case. So those individuals are identified as a high risk exposure group, and those are the ones that we do self-quarantine. The self-quarantine measures mean that you do have to stay in your home. We don't want to allow anybody in or out of that home for that time that quarantine is in place. That's just going to protect you and anybody in the community from the risk of exposure. If there is any needs that are needed, then we do ask that you reach out to family members if available or the health department, and we will see if we can meet any need that is required to keep you safe. And then we have low risk exposures where transmission is unlikely. Those are individuals who had social contact for a short duration. So that could be just walking by somebody on the sidewalk, walking by somebody that was getting gas, pumping gas up next when you and the other individual getting gas at the same time, or working in the same workplace, but not had a close contact within that workplace. So not being around that positive individual for for 10 minutes with less than 6 feet. Those are low risk exposures. So those individuals, we do not self quarantine. We just ask that you continue to follow social distancing measures and to practice all the precautions and preventive measures with the cleaning the high touch surfaces, good hand hygiene, washing your hands, being mindful not to touch your face, and always wearing your mask when you are in public. And then Mona had touched a little bit on how a close contact investigation happens when there is somebody within the community that is found to be positive. So this is just a diagram to kind of help visualize what it actually looks like. So the person there with the green circle around them, they are the positive case. They're the individual that has tested positive for COVID-19. And then you have the 3 individuals that are in the blue circle. Those are the close contacts. So they have either lived in her house, live in the same household as what she does, or they have been identified as a close contact because she has spent more than 10 minutes and have been at less than 6 feet away from each other during that time frame. So those close contacts are then identified and are notified that they are alerted that they were a close contact and that they do need a self-quarantine. And then we follow up with them on a daily basis to help monitor symptoms, to help with any needs that they need, again, to make sure that they are staying within their home and not going out into the community to keep everybody safe. And then the individuals outside of the blue circle that are within the black circle is everybody else. So those are the very low risk transmission exposures. Those are individuals that had contact with a close contact, but did not have direct contact with that positive case. So the risk of exposures for them is very little. If at any time one of the close contacts that were identified in the blue circle does develop any symptoms, testing will be completed or could be completed. And then if that was positive, then we would identify their close contacts and start the process over again with them being the positive individual. So that's how the investigation goes. Everybody is followed up with on a daily basis that's identified and to help monitor any symptoms and to help with any needs that are needed. And then the hotline, that is what the public health department and the diabetes departments have been kind of manning over the past couple of weeks to give everybody in the community a resource to reach out to if there's questions, concerns, symptoms, anything to do with COVID that's COVID related. When you call in again, we will ask for your name, your place of residence, if it's here in Winnebago, if it's outside Winnebago, the reason you're calling, and if there's any symptoms present. We're just trying to get as much information needed that we can to properly triage everybody and give them the services or the medical care or the testing parameters to see if you meet testing criteria. Depending on what information is given or what the reason for the calling is, if it's due to having symptoms that are COVID or related to possible COVID, you'll be given different advice to be given. If you need to stay home because your symptoms are mild and you don't meet criteria for testing, then we would have you stay home and do isolation precautions and self-monitor within your home. So with those isolation precautions, you want to make sure you are isolating yourself in a different room if possible, maintaining a constant distance between you and any other household members, and wearing a mask within the home or if you're going to be around anybody at all to help prevent any further exposure. If a COVID test is warranted or the criteria is met, the public health nurses will work with the caller or the patient to help set up COVID testing and arrange it where it's most convenient for that individual. Once testing is conducted, the public health nurse will follow up with that patient on a daily basis until the results are obtained, just to help monitor any symptoms, or if any additional medical treatment or needs is required, then to help facilitate that as well. If testing is negative, then you want to make sure, as Mona had mentioned, that just because you're negative now doesn't mean you cannot have a future exposure within a couple days. So you want to make sure you're still maintaining that social distancing, that you're still monitoring for symptoms, and if anything does arise, that you do contact your provider or the Winnebago Public Hotline to help evaluate if another test is warranted based on the symptoms or if there's another exposure. If the test is positive, then the Winnebago Public Health Department and the nurses will check on you daily or twice daily, depending on the severity of symptoms, and will again help you with any needs that are required to keep you safe and keep you isolated in your home to prevent any further exposure from happening. If you do develop symptoms or you are found to be positive, I'm just going to quickly go over what needs to be done to help self-care for those individuals. The most important thing is to stay home. You want to stay home. You want to stay away from any public places. You need to stay isolated with hopefully to one room in your house. If you do have to share a restroom with somebody or with other household members, you need to make sure that it is wiped down in between each use to help prevent any further exposure to any member in the household. You need to monitor your symptoms. The most important, checking your temperature twice daily. We did get some thermometers in that you can sit on your forehead and get temperature reading that we can give out to you to help monitor for that temperatures and do those twice daily. It's really important you stay hydrated and get plenty of rest. That's going to be the one thing you can do to help your body fight off that infection. If you need medical attention, call your healthcare provider. Let them know that what your symptoms are, if they're worsening or if more developing and you're concerned, to give them a call, and they can definitely walk you through the steps that you need to, if other self-care measures need, or if there's prescriptions that need to be seen, or if you need to come in and be seen. But you need to call ahead. And then if emergency services are needed, you need to make sure that you are notifying the dispatch personnel that you are COVID positive, or that you have been a possible exposure, or that you have a test pending for COVID. That's very important, so we can make sure that those healthcare or those emergency services and the healthcare personnel are keeping themselves safe, so then we can provide care to you in a safe manner. You need to cover all your coughs, sneezes with a tissue. Wash your hands often with soap and water or 60% of alcohol-based sanitizer. You need to stay away from other people. We want to make sure you're isolating your room. Try to maintain that distance within your house of household members. Don't allow anybody in the house that does not live there or is not staying there. And then make sure you're not leaving the home either. Avoid any personal items, sharing any personal items. So razors, toothbrushes, eating utensils, those all need to be, the eating utensils need to be washed properly before each use to make sure that there is not an increased exposure. And then lastly, you want to make sure you're cleaning all surfaces. You want to make sure that any high touch surfaces, countertops, light switches, doorknobs, bathrooms, anything like that is being cleaned frequently to get any bacteria or any of the virus that could be sitting on that surface off. And you want to follow the disinfecting instructions that are on the bottle for the disinfectant that you're using. Next, Laura's going to go over some things that's happening at the hospital, and then she will take over now.
All right, thanks, Angie. Hello, everybody. We'll just go through these quickly. There's just we've cut down quite a bit of the slides, but wanted to go over the highlights for you. So a lot of the processes that we're doing right now, you know, patients are still entering at the east entrance of the hospital, and employees have been given special instructions on where they should enter. All patients and employees are now being screened at the door for possible COVID-19 exposure. We're working with our employee health nurse to track employees and doing contact tracings too, just as Angie is doing. Anyone that enters the building will be required to wear masks. Masks will be provided at the door by the screener if you don't have one. We've been working, patients are instructed to call their healthcare provider or the COVID-19 hotline before coming in to seek medical treatment, and they can help you decide where the best options. We have been working on plans for an influx of patients and performing mock exercises to ensure that we are ready. Staff from all departments have been included. A COVID huddle is held twice a week, and we have a COVID committee that meets weekly. We currently have enough PPE, and we continue to monitor this on a daily basis. The staff does have access to that PPE, and they have the PPE they need to care for the patients. We've had numerous conferences with other entities to ensure we are working together. So I want to go over the testing process. We are asking that if you have worked in a meatpacking plant or anywhere that you or come in close contact, that you do call the COVID hotline, and people have been doing that. And there has been some testing set up for those people by Angie nurses. And it is important to note that a simple diagnosis of COVID-19 infection could include self-isolation and should be the normal, even in the absence of a positive COVID-19 lab result. So we may ask you to self-isolate even if you haven't been tested, but we think you may have COVID. This could mean that you will be told to self-isolate, even if you don't have or have not been tested, or you are waiting for test results. It's very important that you follow these instructions, even if you are not having any symptoms. If COVID-19 test is warranted, meaning the criteria is met, then a test will be sent to an outside lab. Current turnaround time for our testing is 24 to 48 hours, and about the same for the commercial lab. So both labs are coming about at the same time, but that's if it's done here, is what we're finding. We have been working on ways to collect specimens so that we are limiting exposure to staff and other patients. And 12 Clans Unity Hospital does have limited testing capabilities, and criteria is used to review who should be tested. Processes have been put in place to ensure the Winnebago Public Health Department and 12 Clans Unity Hospital are communicating test results and follow-up. And this has been working very well. So this is what the CDC puts out for priorities when you go for testing. And the priority one is, for hospitalized patients and healthcare facility workers with symptoms. Priority two, they do look at long-term care facilities, patients with symptoms, patients 65 years or age and older with symptoms, patients with underlying conditions with symptoms, and then first responders with symptoms. And then priority three, really looking at critical infrastructure workers with symptoms, individuals who do not meet any of the above categories with symptoms, healthcare facility workers and first responders, individuals with mild symptoms in the community experiencing high numbers of COVID-19 hospitalizations. And then right now, the non-priority is individuals without symptoms, like Angie and Mona said, we aren't necessarily testing people that are what we call asymptomatic or no symptoms. We just wanted to let you know that coming soon, we'll be providing telehealth visits. And for that yet, telehealth appointments are not available for every type of visit, but we will be able to do them on some visits. Patients will need to confirm with the hospital staff if their visit qualifies for a telehealth appointment. The hospital will work with all eligible telehealth patients, regardless of access to technology or internet availability, to provide telehealth capabilities. So more to come on that. We just wanted to let you know that that's something that we're working on. So on behalf of our entire Winnebago Comprehensive Health System team, we appreciate your cooperation and efforts to keep our community safe and healthy. And we hope everybody's doing well out there, and have a great day.
All right, thank you, Mona, Angie, and Laura. At this time, we are going to have some remarks by the Winnebago Tribe's CEO, Esther Mercer. Esther, are you there?
Yes, I am. Can you hear me?
Yep, we can hear you. The floor is yours, Esther.
All right, great. Thank you. Good afternoon, everybody. I would like to thank you all for joining us today. As was previously stated, the Winnebago community was informed of the first positive COVID-19 case last week. And due to the confirmation of the positive case, until further notice, unless otherwise noted on the tribe's website, all of the tribe's departmental office hours are going to be by appointment only through the month of May. Please contact our programs prior to your arrival so your needs can be anticipated and ready to address at the time of your appointment. For the safety of our staff and for the community, we will not be allowing anybody without a face mask to enter our buildings per the resolution of the Tribal Council that went into effect on Wednesday. The Winnebago tribe has received an allocation of approximately $1.5 million from the Bureau of Indian Affairs, appropriated through the Coronavirus Aid, Relief, and Economic Security Act, otherwise known as the CARES Act, to assist the tribe with expenses relating to addressing the tribe's COVID-19 prevention, preparedness, and response. Funds will be used to support the purchase of PPE and equipment to help the tribe facilitate teledistancing measures, which will enable our tribal departments to continue to deliver essential services and to support the operation of the tribal government, as well as to continue serving the needs of our tribal members. A portion of the funds were also allocated towards expanding the tribal community garden project to include 3 new greenhouses and a cooler storage space for produce, both of which will ensure the safe and secure access to healthy food for our community members during the COVID-19 period and beyond. For more information on this funding will be published in the next issue of the Winnebago Indian News. Our Planning and Development Office has been working behind the scenes to evaluate the COVID-19 funding as it becomes available, and have been working to match that with the prioritized needs of the tribal programs and the tribal task force subcommittees. The Winnebago Food Distribution Program recently received supplemental funding through the USDA to support disaster household distribution. From now through May 12th, food packages will be available for eligible recipients to access through our food distribution program. In order to qualify for these items, participants cannot currently be receiving SNAP or other food distribution benefits, and the household must be suffering from economic losses or significant food access challenges directly due to COVID-19. Income verifications are not required for this program, and there is no application process. For more information on the availability of this assistance, please contact Food Distribution at 402-878-2799. Finally, the Winnebago Tribal Court will no longer be allowing for visitors or clients to drop off documentation directly at the courthouse. All documentation can be sent to the court via mail, through the intercompany mailbox that's located in the lobby of the Blackhawk Community Center, or via email. All forms of submission will be accepted by the tribal court and filed as of the postmark date. And this concludes the weekly update for the Winnebago Tribe of Nebraska. I'd like to thank you all for your kind attention and encourage you to continue to stay safe and healthy during this incredible time. Thank you.
Thank you, Esther. At this time, we're going to turn the floor on over for some remarks to Dan Farringer, the Superintendent of the Winnebago Public Schools. Dan, can you hear us?
Yes, I can. Can you hear me?
Yep, we can hear you. The floor is yours.
Okay, just the governor again mandates school closure, including all activities and events through May 31st, 2020. The NSAA, that's the Schools Activities Association, will release some information on or about May 15th regarding summer activities, which includes camps and school workouts, what we're allowed to do. Again, our track and athletic complex is being closed until further notice. There may be some work going on as Sam Fisher will be coming in the next week or so to put the topping on the track that we need. The food service and those helping deliver have been and will continue to work hard to ensure the children get breakfast and lunch. And we're doing it being safe as we do it, wearing masks. Remember, we are delivering a week's worth of meals, so please store the food properly after it is delivered, and continue to follow the guidelines of keeping safe that we've been exposed to: washing hands, wiping down containers, wiping down countertops, preparing the food properly. We are working hard to keep everyone safe, and this means less contact to help prevent the spread of the COVID-19 virus. Tomorrow, Friday, May 1st, meals will be delivered for the week of May 4th. Meals for the week of May 11th will be delivered on Friday, May 8th, and the final delivery will be May 15th for the week of May 18th. Please have someone at the sites when we drop the food off. The graduation, again, has been scheduled for August 1st, 2020. And we're also, Mrs. Tremaine is working to contact seniors. We're trying to put together a video to honor the seniors. The goal is to have it on the website by May 9th. Mrs. Tremaine has ordered yard signs and will honor the seniors and will place them in each senior's yard. Mr. James and Mrs. Tremaine will be handling this. Also, the seniors will be able to contact Mrs. Tremaine after May 9th to set a time to pick up their copy of their diploma. The original diploma, again, will be distributed at the graduation ceremony on August 1st, 2020. Again, continue to be safe, work hard to avoid going out, and just continue to be safe, and we'll keep working from our end. Thank you.
Thank you, Dan. And now we'll have some remarks by Manoj from Little Priest Tribal College, the president. Manoj, are you there?
Yes, can you guys hear me?
Yep.
Okay. Again, before I go through my some important stuff from Little Priest Tribal College, again, I want to take this opportunity to thank the Tribal Council, the Pandemic Task Force, the chairs, the co-chairs of the subcommittees, and the public health system of Winnebago, the hospital, and all community members for doing their part to keeping our community safe. Again, on behalf of the college and myself, thank you so much for doing your best. Here is the major highlights from Little Priest Tribal College. Today is the last day of the spring 2020 semester. Kudos to our students for hanging in there during this transition time. It was very hard for them to shift from a face-to-face to online system in few days. Special shout out to all our faculty to make that arrangement as well. So thank you to all our faculty, staff, students at Little Priest for making this happen. Our graduation has been moved to at least August 2020. A date will be confirmed as soon as as soon as we get the clearance from the Department of Education. I'm happy to report that Little Priest Tribal College yesterday received a notice saying that we'll be getting 100 Amazon tablets for our students, especially for our summer semester. That's a huge donation from American Indian College Fund. So those lab tablets will be distributed to our students, especially summer students. As I've stated before, our summer semester is tuition and fees free. And our classes starts on May 26th. I really recommend friends, family members, employees to take advantage of this amazing opportunity to keep yourselves occupied and also improve your professional skills. Also, a Little Priest Tribal College received 10 laptops for our full-time faculty and part-time faculty from AICF. So we are delighted to get this support from American Indian College Fund. Little Priest Tribal College Wi-Fi in parking lot is completed and is ready. So students can drive to our parking lot. We do not want them to be venturing around or moving around. They should be inside their car and working not only for the spring semester, but also for the summer semester. LPTC is increasing security on the campuses by installing more cameras. We are continuing to offer community education workshops at Little Priest Tribal College. So please contact Jennifer Smith if you have any requirements to continue your professional needs. The summer registration is open, as I mentioned before. Classes starts on May 26th. And I want to reaffirm this, that every student taking classes in summer semester at Little Priest will have proper technology backup from us. We will make sure that the students have all the things they need for a successful completion of the summer semester. So more information will be shared on Facebook and our website. Tomorrow, Little Priest College will be moving to a new website, so we are pretty excited for the new for the opportunity, and more screenshot will be shared on our Facebook page. Little Priest Tribal College continues to donate food as and when needed to Winnebago Public Senior Center and any other organizations that are needing any food services. LPTC is working on a textbook pickup plan for summer semester with zero to minimal contact for students. We are thinking of different options. One is to mail the textbooks or to have a drive-through options for students and parents to pick up the books. Again, summer semester is completely online to avoid any contact with the students and the faculty and staff. We are very excited for the completion of the spring semester. We are excited to start summer semester on May 26th. And we want our community members to take advantage of this great opportunity. I wish you and your families safe and health during this pandemic time. Take care. Thank you.
Thank you, Manoj. At this time, we are going to shift to Winnebago. Mayan Beltran is on with us. We appreciate his time. And Mayan, if you would, are you there?
I am. Can you hear me?
Yes, we can hear you good.
All right. Good afternoon, everybody. I just wanted to make the announcement that on Monday, April 27th, Iowa's Governor Kim Reynolds extended the closure of business through May 15th in select counties, including Woodbury County. As with many businesses in the country, we are continually monitoring and preparing for a safe opening as soon as is practical. The casino is working on a comprehensive strategy by department for the safety of our guests and our team members. We have ordered personal protective equipment for when we open. Please make sure you have provided us with updated addresses, email addresses, and phone numbers so we are able to contact everyone in a timely manner when it's ready to bring everyone back to work. You can do this by logging on to your Green Shades account at greenemployee.com. Please note this is also where you will have access to the most recent up-to-date information posted by management. If you don't have access to Green Shades account, you can call 712-428-7116 and leave a message with your updated information, or you can email hr@winnevegas.biz. Continue to stay safe and do your part to prevent the spread, and we will see you soon. Thank you.
Thank you, Mayan, and we appreciate the update. Now we are going to turn our attention to Sam Burch, HCI's Communications Officer. Sam, how are you doing today?
Good afternoon, Garen. Thank you for the introduction. Today, we learned a Pony Express employee at the Atacad location in South Sioux City has tested positive for COVID-19. I'd like to talk about that first. The location has been closed and professional disinfecting is happening today. The location will remain temporarily closed and reopen soon. At this time, our thoughts are with the employee and their family. You can read additional information on the Pony Express store's Facebook page. From the start, we've acted swiftly with a number of steps in both the stores and across the company, which we've described each week in these live stream updates. As part of our planning, we did update safety guidelines for the Winnebago and regional locations over the past couple weeks. Along with planning, I would like to update you on Ho-Chunk Farms and the cattle purchase. They recently purchased 61 head of cattle to help ensure access to beef and decrease dependency on government supply for food assistance programs in Winnebago. The first set of cattle will reach finishing weight in about 100 days, with Ho-Chunk Farms purchasing more cattle to continue the cycle. This project complements larger food sovereignty efforts across the Winnebago community, including a new food pantry. We're excited to learn that an anonymous donation was received by HCCDC, and I'll let Brian talk more about that. The donation is to establish a food pantry in Winnebago with goods from native suppliers. Ho-Chunk subsidiary Sweetgrass Trading Company is sourcing the cultural food items from partnering tribes, helping create an economic ripple effect in those native communities as well. And the food pantry will be located at HCI Distribution with plans to open in the next 2 weeks. We'll keep you updated as that evolves on this webcast, and you can learn more about the cattle and see those photos on the Ho-Chunk Inc. Facebook page. Those are all the updates I have for today. I appreciate your time, and I'll turn this over to Brian Mathers with HCCDC.
Thanks, Sam. Good afternoon, everyone. Couple of things. Sam talked about the donation for the food pantry. We've also had another donation that was coordinated through HCI and through some outreach that Lance Morgan did to some foundations. And in addition to the startup funding for the food pantry, they also provided funding to provide 2 months of rent relief to the low-income tax credit properties and the elder housing in Ho-Chunk Village. So that's a total of 60 residents, low-income and elder residents in Ho-Chunk Village that'll be getting full rent payments made on their behalf for May and June. So that's great. We just found that out yesterday and notified the tenants. So this might be the first some of them are hearing about it as well, but we're really excited about being able to offer that. And thanks to Lance and HCI for helping coordinate that donation through our organization. There's, in addition to the initial startup donation for the food pantry, there's another one that's made additional funding available for that. So we'll be growing the supplies and stock there quite a bit, as Sam said, and looking to finalize the plans for distributing that through the pantry program in the coming weeks. So that's primarily what HCCDC has been focused on, is helping tribal entities and tribal programs and community partners kind of respond to opportunities for and help with the proposal development and grant development, and figuring out some of the programming needs associated with making some of those things happen. In addition to the food, we're also working on projects to create some housing options for self-quarantine or self-isolation if needed, because of the overcrowding that a lot of households experience. Makes it difficult to do that adequately. So we're trying to find some solutions for that, and as well as helping with the community access for Wi-Fi and internet. So we're talking about the fact that we're probably likely as a community to need to move towards more telehealth and teleeducation and telework options. And we want to just increase the community connectivity around those things. So we're looking at some, trying to find some funding and some programming resources to make some of that stuff accelerate a little bit. Let's see, I'm trying to think if there's anything else. That's the main things that we're working on. We have locked down our Woodland Trails building for the time being. If you need to, you can call down to make an appointment, or we still have office staff there, but the doors are just locked. If you needed to come down and we needed to have a distance safe interaction with masks, we can do that. Just call our office and we'll arrange to have somebody meet you at the front door to do that. But those are the main updates from us. Hang in there, everybody. This is a marathon and not a sprint. I've been involved in community responses for tornadoes and floods and things like that before, and this one's really different. It feels really different because the impact is so wide across so many aspects of people's lives, but the community's approaching it as a team, and everybody is doing an awesome job here. So just got to hang in there.
Thank you for the words, Brian. We really appreciate that. And now we are going to turn our attention to John Snowball, the chairman of the Winnebago Preparedness Pandemic Task Force. John, are you there?
Yes, Garen, can you hear me?
Yep, we can hear you. The floor is yours.
Good afternoon, Winnebago membership, community members, and workforce. First off, I want to say thank you to everyone who has played a part in these preventative measures to keep our people safe. To each one of you and your families, you're appreciated, and what you do is important. And it's really good to be a part of that, to be a part of each one of you, and be a part of something that is powerful, that is going to bring us together, and that's going to make us become better. You know, day by day, week by week, month by month, into the next generation, we're going to be better because of this. And we'll identify our weaknesses, and we'll become stronger in each area, and make our weaknesses our strengths. Those are my views, and this is why we started this. And I look at everything as an opportunity for our people. And this is a big opportunity for us to take a look at ourselves and remember what's real and what isn't real. And remember that we should be able to take care of ourselves in each area of our lives, that we should be able to take care of ourselves, that we are a sovereign nation. So I wanted to start off saying that much. And they talked about the food pantry a little bit, and it's really gaining momentum. You know, it's a really good idea, and people like it, and other people are donating to it. So the tribe was the first initial donation to it, and since then there's been two other donations. So it's a really good idea, and it's probably going to carry on. You know, past when we get past this pandemic. It's going to be something that's going to be beneficial to our people that was born from this pandemic, and that we want to take care of our people in that way and make sure that they have nutritious food, and that the hungry are getting food. And so the next obstacle is finding the staffing structure. And I don't think that to be a difficult thing to accomplish, as we as a people, we are proven that we're able to accomplish things like this. And our health subcommittee, we wanted to identify a area that making sure that we're talking about our people's well-being, you know, their minds and their hearts and their spirits, making sure that they're well during these times. And the health subcommittee has made it a point to connect that, and make sure that we're not leaving anybody out, and that we have all the ideas, and we have all the most important people thinking about us, thinking about our minds, and thinking about our hearts, and ensuring that everything that's available is well known to our people. There's some virtual therapy sessions available. If you call behavioral health, the number is 402-878-2911. So I would encourage anybody who's feeling effects of the social distancing and the different things that are going on to reach out to somebody. Maybe just reach out to your family member if you don't want to reach out to behavioral health, and talk and feel good. You know, that's, we as people, that's what we need. We need each other. We rely on each other. You know, something that Roland always says that I liked. He says, we lock arms, and we move forward together. So I want to encourage you to take care of yourself, take care of your mind, and take care of your spirit during these times. The curfew is, I've seen some questions that are coming up about the curfew, and I believe it to be going well. And again, it's one measure. It's not going to replace any measure, and it's not going to completely fix anything. But one thing I did want to point out during the task force meeting was the EMS had reported that they've seen a significant drop in calls during the curfew. And you know, that's one thing that I was like, well, you know, we don't know how it's going to roll out, but you know, it seems like it's beneficial, you know, that our people are really being mindful of their health, and being careful and being safe, and seeing that there's less EMS calls. You know, that I enjoy that. You know, I think well, that's a good thing that happened, you know, because of the curfew. And I know there's some thoughts about people that's making our people be more defined, but I don't believe that to be true. There's other things happening in our community that have nothing to do with the pandemic, and have nothing to do with the curfew. So keep that in mind, that the law enforcement efforts continue, and we have things that we have to deal with on the law enforcement side that are happening. Well, I just want to say that, well, the other update is the mask, the no mask, no service. When I was a kid, you always see the no shoes, no shirt, no service. And I took it serious. Sometimes I wouldn't have shoes on with my dad when I was a little guy, and I thought I couldn't go in. And so that old thought gave me a new idea to take that measure for our people, and take that measure for our frontline employees who keep those stores open so we can get our essential items, that we can do that much for our people, that we could do that much for those employees, that we can do that much for their families, and for everyone, for each one of us to take those safety measures when we're going in there, and to care for each other. And so those were my thoughts, and I pass it along. It was Saturday night. Sometimes I'm at home and I can't put this down, and so I passed it along, and it happened. It happened in a good way, and I think it's really been taken well, and I think everybody felt the same way about it. And I think that each one of us see that was the right thing to do. And I always like to say that there's nothing off the table, and anybody who has an idea or has a thought, I want to hear that, and anything that comes to me, I'm not going to hold on to it. I'm going to put it out there to our best minds, and talk about it, and consider it. And that's the way we're going to find our path, but by each one of us having input and working together. So saying that much, I continue to stay home, practice your social distancing, and look out for each other, look out for your loved ones, look out for your elders, look out for your children, and remember, I think about my family and my friends, and I don't see them like I used to see them, and I don't spend time with them I don't spend time with them like I used to. And I understand in my mind that that's a form of taking care of them, and a form of taking care of my family, to stay away during these times, that I put my family in jeopardy. I might put their family in jeopardy when we're doing that. So I try to think good, and that we're doing the right thing. It's going to take each one of us. It's going to take each one of us to keep going through this, and so I'm really proud. I'm really proud, and I'm really encouraged, and I'm really impressed with the Winnebago people and our workforce, and each one of us have come together to take care of these matters. Thank you, Garen.
Thank you, John. John, real quick here, I'm going to display a graphic that displays the Winnebago Pandemic Preparedness Task Force. And if you see this graphic here, you notice that in that center, there's a lot of entities that are coming together. The Winnebago Tribe of Nebraska, the Winnebago Comprehensive Healthcare System, HCI, and Winnevegas. And John is the chair of the Winnebago Pandemic Task Force, and what they want to address is to develop short, mid, and long-term plans to help ensure the health, safety, and welfare of the members of the tribe during a public health emergency. And what they do is they meet during the week, and they send recommendations up to the council for their thoughts, and then once that they come and it passes by the tribal council, then they enact it. So for example, the no mask, no service was developed by the Winnebago Pandemic Task Force, and initial members of the Winnebago Pandemic Task Force include Esther Mercer, the CEO of the Winnebago Tribe, Alan Post, the CFO for the Winnebago Tribe, Danelle Smith, the CEO of the Winnebago Comprehensive Healthcare System, Mayan Beltran, General Manager of Winnebago's Casino, and Lance Morgan, the CEO of Ho Chunk Inc. And then they also developed and assigned subcommittees. And those subcommittees include community healthcare, tribal food security, communications/IT, education, community utilities, federal and state funding, business and employment, and tribal security. And so there's a lot of work that's being done. And for those folks that want to see more information about what some of the things that the Pandemic Task Force, as well as the Winnebago Tribal Council, are doing, make sure you pick up the copy of the Winnebago Indian News. That will be out on Saturday. It should be in your post office box on Saturday. And the headline this week is amid pandemic, Winnebago Tribe prioritizes resources. So with that, we appreciate John, and we are going to go into our next section. Emily, if you would.
Thanks, Garen. We have the honor today and privilege to hear from a representative from the youth of the Winnebago tribe. We noticed that we haven't heard or had a representative from the youth during, this historic time. So I want to welcome Tyler. Tyler, thank you for joining us on today's COVID live stream. So can you tell us more about yourself?
Thank you for having me. My name is Tyler Lemire. I'm obviously from here, the Winnebago tribe of Nebraska. Another part of my family is from the Mille Lacs Band of Ojibwe. I am currently 15 years old and I'm homeschooled.
Thank you, Tyler.
So, go ahead, Garen.
Oh, I'm sorry, Emily. I just had some questions. If you don't mind, maybe if somebody else has some questions and stuff, but I just wanted to appreciate Tyler for being here. And Tyler, if I could, we're just going to do kind of a roundtable discussion here, and it's important that we hear from our youth. And Emily, we were going to ask Tyler the question of, let's see here. Help me out, Emily. What do we got?
We want to know how the pandemic has affected you personally.
Me personally, I kind of worry a lot. My mom is high risk, and so I have been under intense isolation and trying to keep myself safe for her sake. So as much as seeing that all of my friends from high school are coming back to town and staying isolated, they're trying to keep in touch with me over Snapchat and things like that. And it makes me happy to see them again, but also very sad that I can't go and see them like I used to. But honestly, I'd rather stay safe.
Tyler, what is one thing you missed the most since this pandemic started?
I think just seeing the overall safety of everybody, the life without constant anxiety. But not very much of my life has changed that much since I mainly stay at home a lot. But not much has changed.
Okay. We kind of want to get your perspective. What do you think of the curfew order?
I think it's very vital. It has helped a lot of people stay home and stay safe during the evening hours, and I think that's the most important thing, is that all of our tribal members are safe.
Emily, you have a question for her?
Yeah, Tyler, what do you think about the no mask, no service order that the council put into effect?
Again, with the curfew order, it is extremely vital. The one way that the virus spreads is through perspiration, if I believe I think that's correct. And it's important to keep our businesses safe, our essential workers.
Tyler, final question. We really appreciate your perspective. A lot of times it seems the adults are so wrapped up in the pandemic, the youth are unable to kind of voice their concerns. If you could give advice to the adults during this pandemic, what would it be?
I guess this is just more of what I have to say is more of directed at everybody. One thing that I do is I run a Native youth mental health organization online, just kind of run by Native youth for Native youth. And it's just kind of for a safe space for Native youth specifically. And one of the things that I think we're all worried about is, or one thing that we're all going through is some form of trauma, pandemic trauma, global trauma. This is all going to affect us personally through our anxiety, our worry, the fact that we are forced to stay isolated. So this is probably an extremely hard time for both youth and adults alike, especially since the fact that we are forced to stay at home together when we are usually used to our regular routine through work and school. And it affects everybody, and it's kind of it's a shock to everybody.
Thank you, Tyler. We really appreciate your time, and we hope that we look forward to seeing a lot of accomplishments from you, and definitely your perspective is very valuable to us and to the health department and to the Winnebago Tribal Council. So on behalf of the Winnebago Tribe, we thank you for joining us here today, Tyler.
Yep, thank you.
Emily.
Thank you again so much, Tyler. So now we are going to move on to the Q&A session for healthcare workers and the health department. So just a reminder, if you have any questions related to COVID, you could ask them in the comment section of the live stream on YouTube or on Facebook, or you can email covid@winnebagotribe.com, and we will do our best to answer these questions. So these are questions we've gotten in the past week since our last live stream, and also during the live stream so far. So I'll go ahead and kick it off with the very first question. A user wrote, my boyfriend is Hispanic. I'm enrolled and our kids are enrolled, but he isn't. Will he be able to get a test done at the hospital? The first visit to the hospital, they can't refuse him. Is that correct? Laura, did you want to answer that one for the hospital?
Yep, I can do that. So a person who is not enrolled as a tribal member would not be eligible to come to the hospital just to get a test. Any tribal member that gets tested has to meet the criteria to be tested that we went over in the live stream. We are currently not testing anyone that is asymptomatic or doesn't have the symptoms unless they are a healthcare worker, as they are healthcare workers are on the priority testing list. There are areas that have been set up in the state of Nebraska and the state of Iowa that are testing large groups of people, and we would encourage anyone to take part in that testing if you are eligible. Nebraska is working on setting up these sites throughout the state so that more people can get tested.
So I just want to add to that. So if you do live in the Winnebago community, if you could reach out to the hotline, and it's, especially if you're symptomatic, and we could try to get you to the appropriate testing facility. Like Laura said, the Nebraska.test.com is also an avenue.
Great, thank you, Laura and Mona. Next question, and I do want to be mindful with these questions. We had a lot pertaining the first positive case that was reported last week in Winnebago. We are doing our best, and we will protect the patient's privacy. So we did state that no specific information will be shared pertaining to that case, but this question asks, why did the family from the first positive case have to go somewhere else to get the test? They heard that those tests haven't come back yet, and it would seem they would want to limit the spread. They wanted to know if we didn't have enough tests at the hospital. Mona, can you answer that one?
So the practice at that time was that we did not test asymptomatic people, which we still do not do. So the reasoning behind sending people to Dakota County was that they were having the National Guard, so they were going to be able to test asymptomatic people at that time, and we thought it was going to be the fastest way to get asymptomatic people tested. Hindsight is always 20/20. So we will not be going that route again, and we will be working with our internal resources. But there also has been some issues with the whole process. They're having some issues getting the lab results back, so they are just starting to trickle in. So we're waiting for confirmation from those results. But we have been working with all of the people that we need to work with, and also addressing the limit the spread. Those people that we have quarantined are supposed to be quarantined. So regardless of the outcome of the test, we check in with them every single day to monitor their symptoms and see what's going on with them. So some of individuals that are related to any positive cases and are not symptomatic, we watch them for 14 days. So from day one, which is when you had contact with a positive case, until that 14th day, we monitor you. And then on that 15th day, then you are allowed to resume whatever normal is now with your social distancing and isolation as everybody else.
Thank you. Next question, are the hospital staff properly trained to administer a COVID-19 test? There is a lot of false negatives being reported due to improper administration of the test. What certifications do the ones giving the test have? Laura, can you answer that?
Yeah, so there aren't currently certifications to perform a nasal pharyngeal swab needed to test for COVID-19. This really actually is the same swab or same procedure that's used to test for flu. So the nursing staff has been doing this for quite a while, this same procedure. All staff performing this procedure have been trained and had to be signed off that they have been educated on the steps to perform a nasopharyngeal swab. We currently have not been informed by any of the public entities that there are issues with false negatives at our facility.
Great, thank you so much. Next question is pertaining to the cases in Dakota County. It went from 0 to 600 COVID cases in 15 days just north of us. Are we still able to get referred out? Laura?
Yep, I can take that one. As of right now, there have been no issues referring cases or transferring any patients to other facilities. The hospitals in Sioux City are busier than they were, and we know that, but they continue to have open beds. Sioux City has alternate site locations set up to care for patients if they become overwhelmed. And then also we still have the option to send patients to Omaha, and they currently have open beds.
Thank you so much. Next question is also pertaining to the hospital, so I'm going to direct it as well to you, Laura. Why are family members still being allowed to go in with an adult patient at the hospital? What protocols are in place if a family member or family members demand to accompany a person being seen at the hospital?
Okay, we've gone over our visitor policy quite a few times in the live streams, but it remains that we are not allowing any adults to accompany patients if they right now. But if someone is under as a minor or they can't make decisions for themselves, we will let somebody in with them. We really are doing our best to screen people at the door to prevent visitors from coming into the building. This only works if we have the community's cooperation. We've had some instances where the screener was told that both presenting people had appointments or needed to be seen in the ED, but in the end, that wasn't the case, so they might have gotten through that way. We have also had people that have been upset with us when we don't let the visitors in the building. And there are times that we have to call security or administration to come talk to people. It's not something that we want to do. It's not something that we like to do, but we really need your cooperation and understanding during this time. And we have really implemented every measure to try to keep everybody safe.
Thank you. Next question. Since the first case was announced in Winnebago, I have had pain in my chest. My coworkers say it's anxiety, but I have never had anxiety before. What do I do to check to see if it's anxiety? Mona or Angie, do one of you want to take this?
Yeah, I can. So anxiety can present in a lot of different ways, and it can be a sudden onset or it can be a gradual. A common one that can happen is some tightness in the chest, and it can be misconstrued as a different symptom. But other things can be kind of like a trembling or an anxiousness that you kind of feel that's like just a kind of an uneasiness. The best thing to do is to contact your primary healthcare provider to get further evaluation. Anything that has to do with chest pain, it can be related to multiple different reasons, but anxiety is listed as one of those things that can cause chest pain. So what I would definitely recommend doing is reaching out to your primary healthcare provider, getting an evaluation, or getting over the phone at least, or once the telehealth services are available, doing it through them. And then also reaching out to the behavioral health services that we have here with the public health department. This is a very trying time for everybody, and it's important that we take care of our mental health just as much as our physical health.
Great, thank you so much, Angie. Next question. A community member said, it seems we're doing good on all these new rules, like the curfew and the mask policy. Is there, or do we have any quarantine rules? Mona, can you take that one?
Yeah, so the Winnebago Public Health Department has quarantine and isolation guidelines that we provide to all of the positive cases and close contacts within Winnebago. They are all advised on what they are, and each person is slightly different depending on the exposure. Each of the close contacts are contacted daily for symptoms, and their quarantine or heightened isolation is for about 14 days from the time they have come into contact with a positive case. So it's not forever, but we just want to try to protect everyone as best as we can. And so we do have those specific guidelines in place.
Thank you. In pertaining to that, next question asked was, what happens if I refuse to wear a mask in public? I think it's my right as an American citizen to worry about my own health. So Mona, if you wanted to take that, and anybody else maybe from the tribal council wanted to jump in on that as well, feel free.
So as a member of the Winnebago community, I would hope that you would want to be proactive in protecting yourself as well as others. If you do not have a mask on, you will not be allowed into certain areas or asked to leave. So I would just encourage everyone to choose to wear a mask because it's not only protecting yourself, but you are protecting others. And so that's important to do that at this time. And I'm sure John might have some other insight to provide.
Yes. So it is everybody's right to take their own safety measures, but it's also the Winnebago tribe's right to refuse service to those people in those high traffic areas. If you're not going to wear a mask, and then we're going to take that safety precaution for everyone. And if you choose not to wear a mask, we respect that. But at that time, you wouldn't be able to utilize those areas that we have identified to keep safe for everyone. And so we see that the right of the tribe, and we have developed that ordinance, and it's been enacted. And at this time, I would like to thank the security guards, Winnebago security guards that have been forced there. This is their second day, and we've chosen these security guards because they're community members. So it's more smarter for them. It's more smarter for us, more smarter for their families that they get to work here. They don't have to travel, and they can perform a vital duty. Something that really means something that's really going to help. And I want to thank Mayan for utilizing his position and his authority and to make that happen when it was time and without delay. He said, yeah, we're sending them over. These are the ones, they're going to report tomorrow. And it happened that fast, and I had a meeting with them that day, and I talked with them, and I said, I wanted to know their days off, and that their days off would be the same, and that we were going to try to take care of them and be good to them, and let them know that what they're doing is important for our people, for our community. And so I think it's really good. Not all the time do you get to work on something that really means something that you can really believe in, and that the person that you're working next to, that's your team. And So those things are real special, and those are some of the stuff that I learned from Winnebago's as a Winnebago's employee. You know, it's a special place where we take care of each other, and where we know that what we're doing is good, and you know, and it's helping take care of our families. So I was excited. You know, I was eager to pull on that, and you know, like I said, without delay, it happened. And even some of the certified law enforcement officers that work at the casino, they have been sent over too, you know, 2 of them, to help with our curfew. So we're really drawing on everybody. And like I said, I want to thank Mine and everybody else who's utilizing their authority and their position is to make things happen, you know, make things happen fast. And then so that was my idea behind this whole task force. I wanted the people with the most authority to sit around there and sit around that table so we can make things happen faster, you know, faster than usual is what we need during these times. And so I think moving forward, you know, we are going to ask things of people, and it's in a good way though, you know, it's for the good of everyone. And for the most part, you know, from everything that I've seen, you know, it's a really good response. You know, everybody knows, everybody's showing up. You know, I stood down there yesterday at the Dollar General, and I stood over there down there at the Heritage and the post office and stood there with the security guard. And, you know, everybody that showed up, they showed up with masks, and I was really encouraged. You know, they knew, and they knew that it was taken. That even one person came and he stopped, and he said, "Oh man," and he forgot, and he went back to his car and he got his mask. So I think it's really encouraging and really impressive of how this community is and how we're navigating this pandemic, and how we're all sticking together and to care for each one of us. So those are my thoughts, and on the no mask, no service. Thank you.
Great. Thank you, everyone. Thank you for those responses. I think that was a really great answer to that question. So hopefully that community member, that they got the information that they were looking for. The next question says, the state of Nebraska is starting to relax the restrictions. What is the tribe and department's recommendation? Mona, can you take that one?
So at this time, we won't be relaxing any of our restrictions. We're surrounded by several hotspots, and we want to make sure that we do not let our guard down, but to increase it, especially with the other positive cases that we're seeing in our community and surrounding communities. I know that the governor is relaxing in both Iowa and Nebraska, but I just don't think that would be in our best interest to reduce any of the measures that we put in place. I think we need to be mindful of what's going on, and we do have to travel different areas, and we do have different community members that work in other areas. And so I just want to make sure that we be mindful of that and continue to keep our guard up as we continue through this process. And we just don't know what may be ahead of us. And so if we relax our guard too soon, will that come back to bite us? And so we don't want to do that either, because all of our community members are very precious to us. And so we want to make sure that that doesn't occur.
Great, thank you so much. We did get a question in the Facebook live stream. They wanted to know, can anyone get a thermometer? They haven't had one for years. Angie, do you want to comment on that?
Yes, I can. So the thermometers we have are not the traditional oral thermometers that you would put in your mouth underneath your tongue that would give a digital readout. They are ones that they kind of just stick or go on your forehead, and you have to leave it on for a minute, and then it will give a reading. They are reusable, so we do have some accessible for community members, but they're not your traditional ones. So they come in a little plastic white container, but yes, we do have some thermometers available now.
Awesome. And do those community members contact the public health nursing?
I'm sorry. Yes. So you can contact the public health nurses, or you can contact the hotline and let the hotline know, and then we'll get them out to you, or the CHRs too, and the CHRs can pass that information on. So there's a lot of different avenues you can do to contact us to get one. Thank you.
Great. Yeah, thank you, Angie. And our very last question to end on a high note, we did have somebody say, I'm tired of all the doom and gloom. Can you provide us with something positive? Mona, I know you had some information or something you wanted to say.
So I know there's been a lot of doom and gloom, and I know mainly our lives have been focused on that information just to get it out. So in spite of all this upheaval, we do have a lot of great things that are occurring. We just received notice that the first time in history that the data reveals the prevalence of diabetes in American, Indian, and Alaskan Native adults have decreased nationally. So that's exciting news to hear. The Elder Food Program received additional funds here in Winnebago, and we have started providing freezer meals to the elders so that they can use them for dinner, so that they can limit their need to go out and get groceries. The Medical Services Program has delivered over 500 masks to community members over the past 2 days. Through our vulnerable population calls, we have received a lot of compliments, grateful that we are checking on them. And we have coordinated podiatry, pharmacy, and other visits for our patients that if those calls were not done, they might have had poor outcomes. Our behavioral health program is still seeing an increase in people trying to access our services. We're seeing clients in whatever manner we are able to, whether that is through the phone or in person. The Whirling Thunder Wellness Program is starting a new live challenge soon, so please check out the Winnebago Public Health Department's Facebook page. They've been doing live events on Wednesdays, but they're going to start a new challenge, and so that will be exciting to see. The Winnebago Public Health Department has completed our Tribal Community Health Improvement Plan, and it will be available to review as soon as our website goes live, which I know Emily's working on, and it will be very soon. That was a great achievement, and it has been a painstaking process, but it had stakeholders throughout the community that participated in developing the plan and will continue to assist in meeting quarterly to collaborate and achieve those goals. Our patient satisfaction survey just now went virtual and can be accessed on the Facebook page. This will also help us to acknowledge the great work of the employees in the programs, but also to make improvements in the areas that is needed. We also just received news just an hour ago or so that our Special Diabetes Prevention Initiative funds will be a continue application and not competitive. So that was great news to hear for our diabetes program. Those are just some of the great achievements that have taken place in this past month. So that is hopefully some positive news for you.
That is great. Thank you so much, Mona. So good to hear some good news in spite of everything else that's going on in the world today. So that wraps up, I think, our Q&A portion of this. Just a reminder again, if you have any questions, you can email covid@winnebagotribe.com, and we will answer any questions that you email in next week's live stream. Garen, gonna throw it back to you.
All right, thank you, Emily. We do have a question here, and this is directed to Dan Farringer, the Winnebago Public School. Dan, are you on the line there?
Yes, I am.
The question is, are the school lunches safe to eat now that we have our first confirmed COVID case?
After visiting this afternoon with the sub-health committee, the food is safe. The workers we're doing everything precautionary, wearing masks, gloves, but the food itself is safe. It's the droplets that drop on the container. So that's why we continue to say, stay healthy, wash your hands, wipe down the containers, make sure you store the food properly. And we are sending out a 5-day supply of lunches and breakfast to try to keep the so that we're not constantly here having too many people in the building, trying to cut down on that spread of the COVID-19. But after visiting with Pearl and the health subcommittee today, the food itself is safe.
Thank you. And we really appreciate everybody working hard up there, Pearl, her team, and you folks up there as well. The next question is for Little Priest Tribal College. Manoj, what if interested students do not have internet at home?
Can you guys hear me?
Yep.
Okay, that's a great question. So we have plans to provide internet services to students using different platforms. One is MiFi, one is Jetpack, or through the the parking lot Wi-Fi internet broadband as well. So we have 3 plans in place for any students taking classes in summer semester. And I also want to take this opportunity to answer a question I've been getting on my cell phone: how to register for the classes. Please contact Maria Garcia or Sanaya at admissions, admissions@littlepriest.edu, or directly call 402-878-2380 to register for the classes. But yes, we will be making arrangements for students to get an internet backup with a technology like laptop.
Thank you for that response there. We appreciate everybody being on here. The next one is directed, this is a Winnebago Tribe question, and I believe Esther's still on the line. Esther, are you there? Okay.
Yes, I am. Can you hear me?
Yep, we can hear you. Here's a question that we got through the email. Is the tribe considering hazard pay? I don't think we can afford it with the casino being shut down.
And the answer to that is yes, we are currently exploring the possibility of incentive pay. Right now, it is our understanding that the CARES Act funding may be able to support that initiative. So right now, the tribe is just simply doing the background and looking into the possibility. Again, there's no guarantee that we're going to be able to move forward with it, but we are definitely right now in the initial stages of evaluating it and looking at developing policies to support it.
Thank you, Esther. So we have John Snowball from the Winnebago Tribal Council, the vice chairman, and he also served as the chairman of the Winnebago Pandemic Task Force. And Coley had a appointment, a family appointment today. So John, it's going to be kind of, I think it's going to be, if you don't know some of these questions, then we'll kind of pass on to the next one. But this one came along. Did the council decide to buy pigs? Coley said they would talk about it last Friday at the Treasurer's Report.
Thank you, Garen. And I've been on the council for 7 months, and whenever I've been asked to speak or to provide my thoughts or to talk on behalf of the people, I've never passed up that opportunity. I feel like I have stepped forward, and so I want to fulfill that every time. Every time for the people, stand up and don't hold my words. And don't hold my thoughts, that I should provide them for everybody. So I want to do that, and I'm going to continue to do that every time, and I'll be here. And so we did talk about the pigs. I seen it as everybody else has probably seen it on social media, where these farmers are selling them, at a discount, at a good price. And the reason for that is because the processors are it's nearly impossible to get an appointment with them, and I'm experiencing that myself with the buffalo herd, and I think that's going to be experienced with the cows that were purchased. And I think it tells us something. It tells us that we should have our own processing here, so we can raise our own animals in a good way, and process them ourselves, and be self-sufficient, where we don't have to leave and we don't have to depend on anybody. And I think the mobile processing unit, or looking at a building to develop into a processor, so we can process our own animals, has come up to be one of the top priorities on the food sovereignty the subcommittee for food, and so I think that it shows us that. And if to me, we said it would be difficult. It would be difficult if we bought a lot of pigs and we didn't have no way to process them. I mean, the only way would probably be to call on people, and then we would have to have people gather, which isn't a smart thing to do. So there was too many ifs, and we didn't take that measure. We said, well, we have our buffalo herd, and that we need to figure out, how we're going to get that to the people, and we got these cows, we're going to do that. So I think there was too much going on, but I think it helped us look at ourselves, and it helped us to look and see the path forward, that we need that processing. We need that processing mobile unit or a building where we can process those animals, and right now we don't have that ability. So I think it was beneficial. That it was a good question. Are we going to look at buying those hogs? But I don't think we're able at this point. But we want to gain that ability. Thank you.
Thank you, Vice Chairman. The next question, I just want to do a quick check here. We can't see on our end, but is anybody else from the Winnebago Tribal Council dialed in or on the go-to meeting? If not, we'll go on to the next question, John, here. HCI was started to diversify the tribe and not be so reliant on the casino. Now that the casino is shut down, is HCI going to up their dividend to the tribe?
I could provide my personal thoughts on that, as we haven't discussed that as a table and any conversations that I've been part of. But HCI provides a dividend to the tribe. We use that dividend to help our people with essential services, and the Winnebago Casino helps us, and the 12 clans, with what they're doing, did they help us? So we got all these resources, and we're going to keep building the resources, and the casino's shut down, so we don't have that resource anymore, but we still have some, and if it gets down to it, maybe we would consider that what we would have to do, but I don't think we're at that point yet. No, we're not at that point. The CARES Act is coming, and it's going to get here, and it's going to help us, and help us in each area, to where we don't have to do that, where we can prepare, and even each one of our entities with the payroll protection, that opportunity that was there, and that was open to the whole country, every small business in the country that was open to that, and there was no entity from the tribe that was left out. Each one was able to take part in that, and it's really going to help us. It's really going to go a long way, to staying afloat and reopening and getting things back to normal when it's time to get back to normal. So a lot of good things are happening, and I would like to say that the CARES Act is coming, and we're working on the budget for that, and we are going to do that. We're going to look at our weaknesses and make them our strengths, and moving forward, I think we're just going to be stronger, in each area, and be better as a people, and have a better ability to take care of our most needy. Thank you.
Okay, John, next question. Today I seen Winnebago security guards around town. Whose idea was that? If they catch COVID while working, who's going to pay for that? I don't know if Mayan might be able to chime in, or John, if you want to take that question.
Yeah, sure. Like I said, it was smart for them, because they are community members, and I talked to them, like I said, yesterday morning. It was 7 a.m. We all went down there, and it was only an hour away from where they was going to take their post and start performing the task that they was presented to perform. And what I heard was that they were grateful. They were grateful to be doing something that is so meaningful, and they were grateful to be still working. To still have an opportunity to earn for their family, and that's what they expressed to me. And I felt really good, and looking forward. That's what they do. They put on that security shirt, and they put on that badge, and those are the kind of people that have stepped forward to perform them duties. And there's a lot of us. There's a lot of us that go out and go at risk, to perform what we have to do, the essential services, to make sure that we're still operational, as a government and as a people to provide those essential services. So I'm really impressed. I'm really encouraged by those security officers and how they answered the call. The 1 day notice. That's how fast it happened, and they came. They was there, and like I said, I'm encouraged, and there is that risk. There's that risk for everybody. The Winnebago community has a positive case. That's what I told them that morning. We everybody's aware that we have a positive case, so we're taking these measures, and we think they're good measures, and you're a part of that. And what you're doing is really important for everyone. So I think it was really good, and that they was ready, and they was thankful, and they was proud to be doing what they're doing.
All right, thank you. Mayan, did you want to add to that, or?
Yeah, can you hear me?
Yes.
Okay. Yeah, I want to just reiterate what John said, and I do appreciate our security force out there, our guards, and our 2 security supervisors for stepping up and making that decision to go over there and help out the tribe like they asked. We felt that on the tribal security committee, and that it was needed to help in the COVID-19 response for the reservation over there in different areas to protect the elders and the youth and everyone. So the 10 guards and the 2 security supervisors are all tribal members, whether they're from Winnebago or another tribe. We felt that was a good reason, so that they didn't have to come across the river, as John mentioned. It actually saves them time, that they're not coming all the way to Winnebago and going all the way back, and it keeps them away from Woodbury and Dakota County, which has been spiking with a lot of new confirmed positives. So again, thank you guys for what you guys are doing for the tribe and for our people. And I just wanted to reiterate what John said.
Thank you. Next question here, John. It says, please lift the curfew. It's not working, and I have traffic going by all night. It seems all it does is make more people defiant. Are they even writing tickets?
So I've been working the curfew a few nights when I can, and I'm really impressed. And the nights that I did work, Officer LaPointe, Kenny LaPointe working, and he's nonstop. And he's a really good officer, and he's out there and he's making the stops, and it almost seems like he's making these stops back to back. And I know they started the tickets, and I've been hearing people tickets. I turn on my radio so I can know what's going on, and they are issuing tickets. And the argument that it's making people defiant, I've heard that before, and where I've heard that, I knew the incident. I knew the incident that happened, and it wasn't related to COVID-19. It wasn't related to the curfew. It was actually a felony warrant that was happening. And so I wanted to let people know to be aware that other things are happening. I know even in our community during these times, there was people going around, looking for cars that are open. So people are taking advantage of what's going on, and our law enforcement is combating that. And I just want you to support them, because they're good. We have good officers, and they do a good job for us. And they're part of this community, which means they love this community, and that's hard to get in somebody who's performing a duty. So it's even that much better. It's even that much better that they're protecting their family members and their friends, and so I think the curfew is good. And when it's time, it's going to be lifted. When it's time to lift it, we're going to do that. Thank you.
Thank you, John. And just to kind of back up what John said, there is a lot of people that are appreciative of the curfew, and I think that the council had a lengthy discussion on it, as well as the pandemic task force. So appreciate the response, and again, thanks to all the officers out there for all their hard work. This one might be for Esther as well as John. What is the tribe going to do with the CARES Act money that is coming?
Well, right now, currently, the tribe has been meeting with the different the subcommittees of the pandemic task force. And through coordination of the task force, we're developing lists of priority needs to help the tribe support its efforts in preventing the spread of the virus. Right now, there have been numerous needs that have been identified, and they're currently in the process of being prioritized. However, one of the challenges that we currently have is that we've not been notified of the funding that we're going to receive, and we at this time do not know the amount that we are going to receive. So right now we're kind of basing what we're planning on estimates of what we think is going to come in, but until we know for sure what that dollar amount is, that's all we're able to do at this time is, just be as prepared as possible for when the funds actually do come in, and then from there we'll be able to respond accordingly.
Okay, yeah, that's a good assessment of what Esther has provided, and so that those plans are being put together. Like I said before, the mobile processing unit kind of has moved up to maybe one of the top priorities on the food side, and each subcommittee there's things like that, and our best people with budgets and planning are making those recommendations for the tribal council to decide. And as the chairman of the task force and as the vice chairman of the Snowball, vice chairman of the tribal council, is I want to ensure everybody that I'm gonna make it to where it directly benefits our membership. Make sure that we're that's who it's for. We're a people and we're getting this money to take care of our people. So I want to make sure that it's reaching our people, and so that's what I'll be advocating for. And like I said again, like I keep saying, is making our weaknesses our strengths. I think we should focus on that and focus on having direct impact for our families and our most needy. Thank you.
Thank you, John. Next question here. Why are people that have COVID not quarantined? ? I see family members that come into contact just roaming around like it's nothing. It's highly contagious. Also, what did the council decide on putting stipulations on tribal members that continue to work at meat packing plants? Coley said they would discuss at the treasurer's report.
So during the task force meeting, I was made aware of that Mona was having some thoughts, and she was having some obstacles on having these people coming in contact with these people and ensuring that they're following the guidelines. And I witnessed some things on myself, and I reached out to our healthcare facility, our healthcare system, and we said that so I strengthened with my thoughts and what I wanted. I wanted to strengthen what Mona wanted, and that has happened. And there's something that's an ordinance that's coming that is almost finished to where if we need to where these people aren't following where our people who are presenting a risk in our community, so we can help them, have a place for them and have guidelines for them and do whatever we need to do to make sure that it doesn't spread in our community, and utilizing all of our programs to make that happen. And so that plan has been thought of, and it's been worked on, and it's almost ready. When we think of these things, it's only a thought, and then we gains momentum, and we get the right people working on it, and then maybe a few days later or a week later, then it happens. We try to make it happen as fast as we can, and then that's what we've been doing. So, wouldn't say that much. I don't know if Mona wanted to add anything to it.
Yeah, John exactly is correct. And so we have seen those issues with the isolation and quarantine guidelines that we put in place. And so we have been working as the Winnebago Comprehensive Healthcare System with the health department and the tribe's attorneys on drafting language that would put more teeth to what we're asking to do to protect our community and protect our people and protect them. And so that information should be presented to the tribal council within the next few days, and then we'll just present it to the community after the council has reviewed it and if they've decided to put that in action.
And then Councilwoman Whitewater reached out to me yesterday with the same concerns, and I filled her in on that's almost ready, and she was encouraged, and she supports it, and I know there's a lot of other council members that feel the same way. Me and I thought about if I were to become ill, what would I want to do? And I would say, well, I would probably want to go somewhere. I wouldn't want to risk my family. I just want to go somewhere and to where I'm not risking anybody. I don't want to. If I ever got it, I wouldn't want to pass it along to anybody. And so we're looking at places where people can do that, where people can really self-isolate, and and we don't have that yet. But those plans are coming. We're looking at it at all different directions.
Thank you, Mona. Thank you, John. Final question that we have for this week's live stream. I just want to say that I'm proud of my tribe. The council and health department are doing the best they can with all that is going on. Thank you for doing the curfew and mask requirement. The Nebraska governor doesn't seem to care about us. Is the tribe even working with the state? And then the second portion of that question is, I think we are on our own. Are we working with the other tribes in Nebraska?
So there is the Nebraska Intertribal Coalition, which is the Winnebago tribe, Omaha tribe, Ponca tribe, and the Santee tribe, and those we're looking to each other, and sharing ideas, and seeing what we're doing, seeing what's not working there, seeing what's so we have former chairman Frank White was the one that developed that for us, and that made those connections for us to them other tribes, those other Nebraska tribes. We're in it together when it comes to Nebraska, and so we have that, that strength has been put in place for us, and I'm really encouraged as well on all the preventative measures. Where everything that we've done, we're not going to get this thank you letter saying this is how many people that you prevented from getting sick. We're not going to get that payoff. We just have to keep stepping forward. And I like to say that I'll stand up for each one of us against anybody and anything to make sure that we're safe. And if it's only one person that we're preventing from getting sick, that was worth it. It's worth it. It's worth all of these preventative measures. And I would just like to encourage everybody to continue to stay strong, and understand that this is, we don't know how long it's going to go, but we're like I said before, what Roland says, and what I like is, we can lock arms and we can help each other, and we get through this. And, each one of us, protect each other. Thank you.
Thank you, John. And ladies and gentlemen, we want to say thank you to Little Priest Tribal College President Manoj, Laura Gamble, Mona, Angie, Emily, for everything that you folks are doing. Again, we want to thank HCCDC, Ho-Chunk Community Development Corporation, Brian Mathers, HCI, Sam Burch. I know that your hands are full, and we appreciate your time being with us here today. Mayan Beltran, we look forward to the casino opening, but we know we got to do it in a safe manner. But we appreciate you coming on every week to address our people. And also the superintendent, Dan Farringer, we want to thank you. And more importantly, we want to thank Tyler Lemire for your thought, your student and your youth perspective. And that is very valuable. And I think that with that, we'll leave the closing remarks to John. And we'll be signing off here. John?
So, when I was younger, I wasn't this way. I wouldn't stand up and talk. I was a shy person, and through different things that happened in my life, hardships, I grew. and even having children, and at times not being able to give them not only what they want, but sometimes not what they needed. So I grew, and I became the person that will step forward and will do what needs to be done. So I see that as an opportunity for our people to do the same. When it's hardships, we have proven that we're gonna come out, come out on top and come out better, and into the next generations. And I see this as no different. And so I'm encouraged, and I feel stronger than ever. And I'll say about that much, and use that much time. Thank you.